Welcome to day 2 of our coverage of Bio 2014 in San Diego. My name is Michal Kaczmarski and I am Americas and Europe editor of FDA magazine. I'm here with Peter Egardt, governor of the Swedish county of Uppsala. Governor, welcome, and if we could start very briefly, introduction on the Uppsala for biotech. If you could describe the sector a little bit in your county.
Okay. Well, first of all, I'd like to say that Uppsala, together with Stockholm, that is the capital region of Sweden, we have somewhere around 50% of the growth of Swedish GDP each year, and we have about 65% of biotech or life science industry and research located in Sweden, located to Stockholm, Uppsala. So this is a strong point, we believe.
Sure. And what do you think should bring investors' attention to that region, except for the size?
Well, I think that there are a lot of arguments, of course. We have a number of world-leading universities, I'd say, with the Karolinska in Stockholm, Royal Institute of Technology, Stockholm University, Uppsala University, Swedish National University of Agriculture. So there is a cluster of very high-quality universities with a big number of students and research fellows and faculty, of course. And then we have industry located in the area, with big pharma as in AstraZeneca, and in not that many others that have big locations there. But of course, GE Healthcare and all the others, they are there one way or the other.
Now, apart from targeting biotech as a whole and attempting to be a biotech cluster, is there any subsectors that the region is applying or is priding itself at being?
Well, I'd say that when it comes to value-added healthcare, using biobanks, using patient registers, for instance, that's one of the strong points, because we can utilize
new development in the region. I know that right outside of Stockholm there's actually a new biotech cluster being built, right?
Yep, that's right. That's part of the Stockholm-Uppsala region, because AstraZeneca has left its premises in Södertälje, and together with the Uppsala Innovation Center, we are building up a new cluster with a lot of financing from government and from private business. So,
what's the figure for that whole project? You know?
Ooh,
that sounds very big.
Well, it's big. Well, I can't give you an exact number, but a lot of money poured into that, and the biggest investment, really, government investment, is in our SciLife lab activities. It's a joint venture between Uppsala and Stockholm, 5 universities involved, and where we have the genome infrastructure arranged, and that is the government has put somewhere in the region of $200 million into that, and private business will as well. But that is giving the infrastructure, and that is also, at least in the Swedish context, very, very unique.
Sure. Now, here in San Diego, what companies or what type of meetings and individuals you are targeting? What would you like to get out of being here?
Well, that's a good question. It's more of a benchmarking exercise to see what's going on in other parts of the world and what's going on here, how we can connect, and also how we can get others interested, of course, to join us in developing the life science industry, which I think is extremely important now when the pharma industry is going through some kind of paradigm shift, and where we have this value-added, more patient-oriented approach. which we haven't had to the same extent before.
Now, apart from that, what else is going on? Anything that you noticed, Governor, after the first day of Bio?
As I mentioned to start with, as this is so important to the capital region of Sweden and to our GDP, and I may mention also that in Europe the Swedish economy is the economy that fares most well. So we have managed to take care of the financial crisis in a better way than other European countries. So we have growth, and it's hopefully increasing.
Now, for looking for partners, would you rather look for partners in established biotech clusters, or would you rather look for the up-and-coming stars?
Well, I'd say that we won't exclude anything, of course, but I think that there are a number of clusters that are more interesting than others. And if you take the US as an example, of course you have the Boston area, you have San Francisco, and there is San Diego. So of course that is one of the reasons why we are here. We wouldn't pick any other to start with, because these have the critical mass and have shown success so far.
So developed locations then, or established locations?
Yeah, I think that's the main focus.
Now, speaking of the emerging markets, as you will see at the floor, there's a lot of both companies and economic developers from emerging markets. Do you see them as your potential future partners at some point, or some places that you can learn from, or rather competitors that can steal away some investments from you?
You can always learn. No, I think that the market for life science products, if you will, is enormous, and I think that emerging markets are, of course, also big markets for Swedish companies, Swedish ideas, and what we create.
Especially given that the Swedish market is so much smaller as compared to India, Brazil.
Absolutely, but I mean, we have been quite successful with big pharma and with pharmaceutical research over a long, long time, and I think that we are, for instance, very good at infectious diseases, which there is a big demand for all over the world, I'd say, and especially in the developing countries. So yes, the market potential is enormous.
Governor, thank you so much for your time, and let's see what the rest of the second day at Bio brings. Thank you very much.
Right.